Right, it's 6 o'clock, so I think that we'll get going. We were expecting a large number on the call tonight, and I'm sure that members will join us as we get going. Anyway, a big welcome to all those on the call tonight that are joining this webinar. This is hosted by RCN West Midlands. And this webinar is statutory leave within the independent health and social care sector. To do some introductions, my name is Lindsay Meeks, and I'm the Regional Director for the RCN in the West Midlands. And on the call, we also have Jenny Watts, who's one of our national officers in our Employment Relations Department. So this webinar is the first one in a series of two. The next one's next week on the 17th of December between 6 and 7. And as I said, this one's looking at the statutory leave within independent health and social care. And next week, we'll be looking at the pay element. So we'll obviously be very keen that you join that one also. As you can probably see, your camera and mic are muted. That's just to allow good housekeeping, allows us to present without being muted, etc. So if you did want to come in, particularly in the Q&A section that we'll have a bit later, then do please put your hand up and we'll put your camera on and take you off mute. So you can come on and talk to us directly if you would like. So the way we're going to go ahead with this is Jenny's going to present her slides for about 30, 35, 40 minutes or so. And then we will move into the question and answer session and hopefully finish up just before 7. There will be an evaluation that we'll put into the chat and we'll obviously be delighted if you could please complete that. Okay, so without any further ado, I will pass you over to Jenny to take you through the slides. Many thanks, Jenny.
Thank you, Lindsay, and hello, everyone. It's really nice to be with you today. I'm just going to start by telling you a bit about my background, just as an introduction as we go into this webinar, so you know a bit about where I'm coming from when I'm giving this information. The first thing I wanted to say is that this webinar was prepared by my colleague Barry Hutchinson. He did the webinar last year, if anyone attended, and he will be undertaking part 2 of the webinar. Unfortunately, he can't be here today, but we've worked very much in partnership. So I'm going to be doing this part 1 that he's prepared, and we've discussed it together, and he will be doing part 2. Let me start by telling you a bit about myself. I work for the Royal College of Nursing and I work in the employment relations team. And a lot of this webinar is going to be looking at the language we use and the terminology. So I just wanted to explain a bit about that. So in terms of employment relations, all employment relations are how workers in a workplace relate to their employers. So I'm coming to you today as the expert in one of those areas. We also have experts that work in our region that work in employment relations, and my colleague Lindsay, who's just introduced this webinar, is one of those. So that's our specialism. That's how we're coming to you today to talk about employment relations and the specialists in employment, really. So we are focusing very much today on employers and workers who work in what we call the independent and health and social care sector. Now, I think it's important for us to explain that in the UK, anything that is not the National Health Service, we refer to as the independent health and social care sector. So you can imagine that that is a really wide group of employers. It's very broad. And there's lots of different sectors. But if you are here today and you do not work for the National Health Service, the NHS, this webinar is very much for you. We will try to give as broad an understanding of everything as we can. But this is what I say when I mean I work for employment relations in the independent health and social care sector. That's my job. What I do is I link with lots of different national employers. Sometimes we have an agreement with a national employer, which we call a recognition agreement. So we may be invited in to talk about pay, terms and conditions of people that work there. In many cases we don't, but we'll still try to work with that employer and maybe influence them. And we absolutely, in those employers, we always find a way to work the best we can with our members of the Royal College of Nursing who are working in those different employers. We have lots of different member groups that do the same, that represent them, but this is some of the background. So that's our team. In terms of myself, although I work as in the employment specialist part of the organisation, I am still a registered nurse. I'm a registered nurse as an adult nurse, a registered nurse as a children's nurse, and a registered health visitor. And this gives me quite a nice understanding when I'm talking about employment relations of the perspective that our members have working in these settings. I've worked in lots of different roles across London and the southwest of England, and I've worked in the independent sector and I've worked in the NHS. So it's a little bit about me. The information that we're going to be covering today is quite technical information with lots of definitions. I'm going to go as slowly as I can, and it's really going to be about giving you that information, that knowledge. But I understand that there's quite a lot of technical information for you to absorb, and this is one of the reasons that this is part one of 2 webinars. I'm going to go through the objectives in a minute, and I'm going to tell you what we're going to be talking about, but it's really important that we understand, especially for the questions, what we're not talking about today, because there will be an opportunity to talk about it at the webinar next week. So I think very much if you, and I'm repeating what Lindsay has said, but very much if you're here for this webinar today, really it goes hand in hand with the webinar next week. So just to reiterate, there is another part 2 of this webinar, and that's next week, which is Thursday, the 17th of December. Oh, sorry, apologies. Tuesday, 17th of December. I think that might be a Tuesday, 6 to 7. My colleagues will correct me if I'm wrong on that. And that webinar is called Understanding Pay in the Independent Health and Social Care Sector, and it's part 2 of this webinar. One thing I would say, and Lindsay has mentioned this as well, we appreciate there may be questions that come up from some of this technical information. If there are some questions that we can answer that are broad questions about some of the topics, we'll do our very best to answer them today. It may be that some of the questions will need to be reviewed and looked at and will be answered in part 2 of the webinar, depending on time and how technical the questions are. We appreciate that some of the topics that we'll be covering today potentially or actually will affect you, and you may have questions about your individual situation. And what we would say is absolutely respectfully, but if there are individual questions about your situation, what we would encourage you to do is to seek individual advice. If you're a member of the Royal College of Nursing, I just very briefly wanted to tell you about that. We'll tell you again at the end and potentially put some information in the chat bar. If you want individual advice on your situation regarding this topic, we would advise you to ring one of our services or to go online to one of our services, whichever you'd find more convenient. And that service is called RCN Direct. So this is the advice line section of the Royal College of Nursing. There's lots of information on our website that you may be able to access, and you may get the answer to your question there. But if your situation is more complicated and you want to talk it through, we would advise you to ring our advice line if you are a member of the Royal College of Nursing. So the advice team are available on weekdays from 8:30 a.m. to 8 p.m. So that's weekdays, Monday to Friday, 8:30 a.m. to 8 o'clock p.m. And on the weekends, they're available 9 a.m. to 4 p.m. on weekends. This may be reduced hours on bank holidays. So do have a thought about how your question needs to be answered. The other thing we want to be mindful of is about people sharing personal information in the chat bar. We would encourage you to any personal or individual information to discuss that with our advice team. Okay, so let's move on. What the webinar will cover. So in this webinar, we are going to be talking about statutory leave, and I'm going to be talking a little bit and give you a little bit of a definition. Now, the main thing about that is there is a difference between statutory leave and contractual leave. And again, we'll go on to that. But those are the language and the concept that would be really helpful for you working in this sector and for all of us. It was actually very helpful for me to refresh my knowledge on this when I spoke to my colleague Barry about this. We'll be identifying the types of statutory leave that are available to those working in the independent health and social care settings and the eligibility. Now, what this won't do today is explain the pay that is associated with statutory leave or indeed contractual leave. That's not going to be discussed today, and there should be no assumptions made that statutory leave would be fully paid. That's really for the next webinar. It's to explain which bits are paid and the rate they're paid is for the next webinar. And I appreciate that might be what you really want to get to the heart of, but actually some of these issues and the definitions are really important to know in the first instance, and that's what we're going to be focusing on today. So if we can move to the next slide, please. So statutory leave versus contractual leave. So this is the main concept we're talking about statutory leave today. So statutory leave is leave away from your employment, away from your work, or away from your job. And this is leave that the law says you're entitled to. So we're going to outline that in a moment. It's statutory, that's the term we use. It's what the law says you're entitled to. This is different from contractual leave. So when you enter into employment, you should all have a written terms of your employment that we refer to as a contract. And in that contract should outline the agreement that you have entered into with your employer that tells you what you are entitled to on top of the statutory leave, what the law says you're entitled to. So contractual leave is always in addition to statutory leave, and it should be very clearly outlined in your contract. If you have any doubts or questions or aren't quite aware of that, I would really advise you after this webinar to get your written contract and to actually go through it. It should outline all the issues around your leave in that agreement. And if you have any issues with that individually, again, I would seek advice from an appropriate source. If you're an RCN member, that appropriate source could be our helpline, our advice line, which is called RCN Direct. So your employer must allow you to take the statutory leave if you qualify. And we're going to be spending some time going through that qualifying information. Your employer cannot give you less than that statutory leave, but they can give you more. And the more that we've outlined should be outlined in your contract and is called contractual leave. I hope those two concepts are clear at the beginning. I'm trying to leave as much time and space to just let those sink in, because really the basis of that definition is how we move on to the next bit. So just to say again, statutory leave, the law says you're entitled to it. Contractual leave, it's what you've agreed with your employer that's in addition to statutory leave. So let's move to the next slide and go into a bit more detail. These are the kind of leaves we're going to go through today. And for some people, these words and the definitions will be absolutely clear. And for others, I'm just going to give a little bit of background, but you may want to go and find out a bit more. So we're going to look at what statutory leave is available. And remember, this isn't about pay, the pay element. So you may have this leave, but please make no assumptions about what pay you'll get on from a statutory basis. That's next week. But we're going to talk a bit about the eligibility for maternity leave. This is the period of time that a mother is legally able to take away from their employment or their job to spend when they have with their new baby once they've had a baby. So most people are very aware of that term and there's no issues, but again, that's maternity leave. We're also going to talk a bit about adoption leave, and I'm sure a lot of people are aware of that, but in terms of definition, it's a legal process where rights and responsibilities for parenting a child are transferred to adoptive parents. It's a court that gives that order, and then they become the child's legal guardian. So that's leave around when that process happens is called adoption leave. Paternity leave is similar to maternity leave, but with very different levels of time you're entitled to. But it's a period of time that a father is legally able to take away from his role to spend with a new baby. We're going to talk about a concept called shared parental leave, where maternity leave and paternity leave can be shared in terms of the entitlement. So we'll go through that. We'll go through individual parental leave for your leave for other reasons for your child. Dependence leave, those that are dependent on you if they need you, what's your entitlement? We are going to go through parental bereavement leave when I'm very sadly and unfortunately parents might have to be dealing with the death of a child. We will be talking through annual leave. This is time away from work. Sometimes people may be familiar with it being called holiday leave or even vacation leave. And finally, we'll talk about the statutory requirements for sick leave, and that's time away from work due to illness. Okay, so I appreciate that's quite a lot to go through. We're going to go through each one individually, giving you some information. So let's go to the next slide. And we're going to start with statutory maternity leave. So in the UK, this is up to 52 weeks in total. Make no assumptions about pay. That's next week. But what's really helpful, I think, is to know what terms we refer to it as. In terms of your employer, your managers, they may start talking to you about this, but it's really important for you to be aware when they use this language what they're referring to, which is not always obvious, to be honest. So this is really helpful for us to have this conversation. Weeks 1 to 26 of maternity leave is referred to as ordinary maternity leave. And weeks 27 to 52 is known as additional maternity leave. So those are the two terms that you will hear, and you can see they're different parts of the leave after you've had a baby on maternity leave. To qualify for maternity leave, you must tell your employer at least 15 weeks before the expected week of childbirth. So this is obviously something your maternity services, you'll be working with them, your health services will be telling you, this is your expected week of childbirth. And again, this is very helpful because it gives you that understanding that of the time scale. So 15 weeks before is the time that your employer would want to know and understand to qualify for that leave. There is information you need to give the employer 15 weeks before. So you need to give your employer the date the baby's due. So we talk about, in healthcare, we will talk about that being the expected week of childbirth. The thing you will need to think through and plan that far in advance is the date that you would want to or expect to start your maternity leave and the date that you are planning to return. So again, helpful to see all of these timescales, and this will be a common theme when we're talking about statutory leave, is really being organised and understanding in advance the timings that your employer would expect you to tell them different pieces of information to qualify. If it's requested as well, your employer may ask for proof of pregnancy. So let's move on to the next slide about maternity leave. So in terms of taking maternity leave, the earliest you can start is 11 weeks before the expected week of childbirth. So that is a decision you could make, but as you can see, those are the steps you'd have to go to. You'd be telling your employer that. If the baby is born early, leave starts the day after the birth. You must take at least 2 weeks of maternity leave after the child's birth. That's part of the statutory requirement. You can change your leave start date, and this is another one I think for people is helpful for people to know. So you can give all that information to your employer as we've previously stated, but if you want to change the date, you still have to give 28 days notice of that new date. So again, it's just about being prepared, thinking it through, understanding that timeline for your employer. In the same way, you can change your return to work date, but you must give 8 weeks notice of that new date. So those are the things to think through for maternity leave. I'm taking some pauses because I know it's a lot of information to take in, and we've got a lot of areas to go through. So we're going to leave maternity leave at that point. And again, I apologise, I know I keep saying it, but in case we've had other people joining, to understand if and what pay is associated with this statutory leave, you must come to the webinar next week, and that will be fully gone through. So let's leave maternity leave there and we'll move forward. Thank you. So we're going to move now to adoption leave. We gave you the definition of adoption. But there is statutory adoption leave, and it reflects the maternity leave in that it's up to 52 weeks in total, and the language reflects that as well. So weeks 1 to 26 are known as ordinary adoption leave, and weeks 27 to 52 are known as additional adoption leave. So this is the qualification you need for this statutory leave following a UK adoption. So we're going to be, there's slightly different information for the UK system. So we'll go through that the next bit in a moment. So for a UK adoption, you must tell your employer within 7 days of being matched with a child. So you can see the big difference in maternity leave, and that reflects the reality of the adoption process. So within 7 days of being matched with a child, the information you need to give your employer is the expected or actual date the child will be placed with you. In a similar way, you need to think through and give your employer within this time frame the date you want to leave and how much leave you plan to take. So you can see there's similarities, but the time scale is different. And this is some of the technical information for all the statutory leaves. It'd be good for you to note down and understand is the notice to qualify, the notice that you need to give your employer for all these things. So if we move to the next slide for adoption leave. So this is the adoption leave now for overseas adoption. So just to highlight those two different adoption processes, the UK process and overseas process. So we're now moved on to the overseas adoption process. So you must tell your employer within 28 days of getting the notification, the date of the notification, and when the child is expected, or when you expect the child to arrive in the UK. Within 28 days of the actual date the child arrives in the UK and the date of arrival, and at least 28 days before the start date. Again, it's about your own planning, how much leave you plan to take and when you want to start it. That's the information that the employer will ask you for. Similarly to maternity leave, your employer may ask for proof of adoption, and if they do, you must provide it. You will not qualify for adoption leave if you adopt a stepchild or a family member or adopt privately. So we're going to be moving on now from adoption leave. And next slide, please. Oh, apologies. Next slide is adoption leave. So adoption leave can start when you've been matched with a child by a UK adoption agency, on the date the child starts living with you, or up to 14 days before the expected placement date for UK adoptions. When the child arrives in the UK or within 28 days of this date, that's overseas adoptions. You can change your start date if you tell your employer at least 28 days before the original start date or the new start date, whichever's earlier. And you can change your return to work date if you give your employer at least 8 weeks notice of the new return date. So I believe now we are moving on to the next slide and the next topic. So paternity leave. So paternity leave, statutory paternity leave, is 2 weeks to look after your child or partner following the birth or adoption. And what you can note here is that this can be taken as a 2-week block or 2 separate weeks. To qualify for this leave, you must be the child's father or the husband or the partner of the child's mother, or be the child's adopter or the husband or partner of the adopter. You must be responsible for the child's upbringing, and you must be continuously employed for at least 26 weeks by the end of the 15th week before the expected week of childbirth, or by the end of the week in which you are matched with a child for UK adoptions or the end of the week in which the child arrives in the UK for overseas adoptions. So you can see this paternity leave here is outlined for new babies and adoption leave. So if we move to the next slide. So for paternity leave, for a birth, you must give your employer at least 28 days notice of how much leave you want to take and when you want to start your leave. For an adoption, you must tell your employer no later than 7 days after you or your partner are notified of being matched with a child, how much leave you want to take and when you want to start the leave. So next slide, please. So in terms of taking paternity leave, after the birth, this is for the new baby, paternity leave must start on the actual date of birth or an agreed date. So you can give that agreed date if you're anticipating you want to take leave at a certain time. After adoption, paternity leave must start on the date of the placement or on the date that the child arrives in the UK, or again, you can agree a date after the placement or arrival. Paternity leave must finish for births within 52 weeks of the birth, so you have to take it within that time, or for adoptions also 52 weeks, but from the placement or arrival in the UK. So I think we're moving on for paternity leave now. So next slide, please. So shared parental leave. Statutory shared parental leave can be up to 52 weeks of maternity leave or adoption leave, and that's shared between the partners or parents of the child. To qualify for shared parental leave, you must have responsibility for the child with either your husband, wife, civil partner, or joint adopter, the child's other parent, or your partner if you live with them. You or your partner must be eligible for statutory maternity leave, statutory maternity pay, or maternity allowance, or statutory adoption leave or statutory adoption pay. You must have been continuously employed by your employer for at least 26 weeks. So if we can have the next slide, please. Before you can take shared parental leave, the child's mother or adopter must have taken at least 2 weeks of that maternity leave or 2 weeks of the adoption leave. So that's the starting place for then agreeing that shared paternity leave. Those 2 weeks must have been taken. And then ended the statutory maternity leave or statutory adoption leave by returning to work, or given the employer binding notice of the date when they will end their statutory maternity leave or statutory adoption leave, or ended their statutory maternity pay or maternity allowance or statutory adoption pay. So if we have the next slide, please. So to take this, shared parental leave, again, this is again about understanding the notice you need to give your employer to be eligible for some of this leave for yourself. You need to give your employer 8 weeks notice of the date you want to start. You need to give your employer a declaration that your partner meets the requirements for shared parental leave with your notice to take the leave, so at the same time. And you must remain employed by your employer whilst you take this leave. This is an interesting one, I think, and I've understood people and known people in different positions with this. So you can take this shared parental leave in one go, so that's one block, or you can split it into 2 or 3 separate blocks. So I think that's helpful for people when you're planning to understand that particular requirement. If both parents are taking shared parental leave, you can take your leave at the same time. So again, if that's a conversation or a planning that you need to undertake, but you can also take it at different times. So I think that's the end of shared parental leave. So I think we're going to move on now to the next slide, please. So we're moving on now to individual parental leave. So statutory individual parental leave is up to 18 weeks of leave for each child under the age of 18. And the reason for this leave is to care for the child's welfare. Again, throughout this, I keep saying it, but please make no assumptions about pay. Next week's session will be covering those issues. You can take up to 4 weeks of leave for each child in any 1 year. So to qualify for this individual parental leave, you must have at least a year's continuous employment with your employer. And to take individual parental leave, you must take leave in whole weeks. So that, again, I think this is a really helpful thing to be pointing out right from the beginning, rather than individual days, unless your employer agrees otherwise. And importantly, and for us to point out, unless your child is disabled. So those are the things really to start thinking about if you're thinking about individual parental leave. You do need to give at least 21 days notice before taking this type of leave. And again, and this is common throughout everything, where again, and to be really mindful for all of these statutory leaves, you need to do some planning, understand it, and give your employer notice to specify the start and finish dates of the notice that you want to take the leave. So if we can move to the next slide. So we're moving on to dependence leave. So as you can see, this is saying this is what we would consider a reasonable amount of time off to deal with a family or a dependence emergency. So a dependent could be a spouse, a partner, a child, a grandchild, a parent. Essentially, what we're saying is someone who depends on you for care. So these are an example of an emergency, but as you can appreciate and imagine, this isn't an exhaustive list. This isn't every list of emergency. Obviously, what we're trying to do here with these examples is just say, here's an example of an emergency that you might want to take if you're considering dependence leave and talking to your employer about what you believe your entitlement is and having that conversation. So examples of an emergency could be, for example, your child becomes ill at school, your partner or husband or wife becomes involved in a car crash, your wife goes into labour, your father's daycare centre closes for the day. So you can see this is not an exhaustive list, and these examples could be used for other people that are dependent on you for care. It's just to give you a little bit of a flavour of how you might want to see, or your employer might see, an emergency. So if we can move to the next slide, please. So taking dependence leave, you must tell your employer as soon as possible that you need to take time off work and how long it might be for. If you cannot if you cannot tell your employer before taking time off, you must tell them as soon as possible afterwards. And you cannot have time off if you know about the situation in advance. So I think we're moving on from dependence leave to the next one now, please. Next slide. So a difficult topic for us all, talking about parental bereavement leave. So statutory parental bereavement leave is up to 2 weeks leave for each child that dies who is below the age of 18 years or is stillborn after 24 weeks of pregnancy. You can choose to take 2 weeks together in this situation, or 2 weeks, 2 separate weeks, or only 1 week. To qualify for parental bereavement leave for a birth child, you must have been at the time of the child's death or stillbirth the child's parent, the parent of the child's parent, or had the child living with you at your home for 4 continuous weeks, ending with the date of death, and had day-to-day responsibility for the child's care during that time. So if we can move to the next slide on this topic, please. To qualify for parental bereavement leave for an adopted child, you must have been, at the time of the child's death, the child's adoptive parent or the partner of the child's adoptive parent. And if the child dies before the adoption order is granted, you will qualify for leave if the child was placed with you for adoption and the placement was not disrupted or stopped. If you or your partner were adopting from outside the United Kingdom and the court order has not been made when the child died, you may still qualify for leave if the child was living with you after entering into the United Kingdom and you had received official notification confirming you were allowed to adopt. So I think we'll move on to the next topic. I think the next slide will, no, apologies, it's carrying on taking parental bereavement leave. So this is the things you must do to undertake, get this leave. So you must tell your employer the date of the child's death or stillbirth. You must tell the employer when you want your parental bereavement leave to begin and how much time you are taking. So again, thinking through, is that 1, is that 2 weeks? Leave can start on or after the day of the death or stillbirth, but must finish within 56 weeks of the date and the death or the stillbirth. If you take leave up to 8 weeks after the child's death or stillbirth, you must tell your employer you are taking leave before the time you would have started work on the first day of leave. If you take leave from 9 to 56 weeks after the child's death or stillbirth, you must tell your employer you are taking leave at least 1 week before the start of your leave. So if we move to the next, please. So we're coming on to annual leave. This is the terminology that we use in the UK, annual leave. But just to reiterate, there may be people we do in employment sometimes still refer to this as either holiday leave or vacation leave. But statutory annual leave is the equivalent of 5.6 weeks per year up to the maximum of 28 days. So we're going to give you some examples of how that will work out, and just to highlight the examples of there is a maximum you can take within that statutory period. So the example we're going to give, the first example is, let's say you work for 3 days a week. So the equivalent of 5.6 weeks would give you 16.8 days leave per year. So you can see how this example is working out. It's basically what we would call pro rata. The amount of time you take is related to the amount of days that you work. So 3 days, the equivalent would be 16.8 days per leave per year. If you work 5 days per week, the equivalent of 5.6 weeks is 28 days leave per year, and quite often that's the figure that you'll hear quoted for statutory annual leave. But as you can see, it's a bit more nuanced. You have to work it out on your own situation. Here's the example which will illustrate the maximum end of the cap on the annual leave entitlement, because if you work 6 days a week, the equivalent for 5.6 days is 33.6 days, but it will only be 28 days because that's the maximum amount of statutory leave you can take. Your employer should designate a statutory leave year. So they should give you a period of time in which you know and understand you take that leave over a 12-month period. So again, let's give you some examples so you can understand how that works. So for example, the leave year that they've designated could be the 1st of January to the 31st of December. So from January to the end of December would be your designated statutory leave year, and that's where you would understand that you had to take your statutory annual leave. So you would understand how much you had to take and when you had to take it. It could be, and a lot of other employers do this as well, for example, it could be that they designate the 1st of April to the 31st of March the next year. That's still a 12-month period. It stretches over 2 actual years, but it's 12 months, and often employers do that because it mirrors the financial year. So quite a few employers, you will see this as the designated statutory leave year, but not necessarily everybody. So again, the principle is the same. They've told you the start and end of the designated year, and it's a 12-month period, and you would understand once you'd worked out how much statutory leave you're entitled to, how much you would have to take, and the period in which you would take it. If your employer doesn't have a designated statutory leave year, then your leave day will start on the day that you started employment. So again, it's really good to be aware of those dates and plan them and have them in. During your first leave year, you accrue annual leave at a rate of 1/12 of your full year entitlement for each month employed. So that's how they would work out your employment, your entitlement. Okay, so we move to the next slide of annual leave, please. Okay, so in terms of taking your annual leave, you must give your employer notice to take annual leave. The amount of notice must be at least twice the amount of leave you want to take plus 1 day. So again, we're just going to give you some examples that you can translate into your own practice. So if you want to take 1 week's leave, the notice will be 2 weeks and 1 day. To take 2 days leave, the notice period will be 5 weeks. So I'm hoping that illustrates how you would work that out, how much leave you should give your employer. Your employer can refuse your annual leave request, but they must have good reasons. Your employer can also cancel your annual leave, but again, they must have good reasons. And that's really important for us all to know when we work in this sector. And they must give you notice. So the amount of notice your employer must give you must be at least the amount of leave you requested, again, plus 1 day. So again, these examples will hopefully illustrate that. To cancel 2 weeks leave, the notice will be 2 weeks and 1 day. And to cancel 8 days leave, the notice will be 9 days. So I'm hoping that all of those examples give you that illustration, basically that formula to understand the requirements for you to take leave and your employer to decline or to cancel your leave. Okay, thank you. If we can move to the next slide. If your employer refuses your request for annual leave or cancels it after it was agreed, they must still allow you to take all your leave entitlement by the end of the year. If you become ill when you are on annual leave, you can take the number of days you were ill later in the year. I think this is one I always try to highlight to people, that if you become ill on leave, be aware of that one. If you become ill before starting annual leave, you can reschedule your leave till later in the year. And your employer must allow you to carry over to the next leave year up to 20 days annual leave if you cannot take all your annual leave before the end of the year because you were off work, unwell, ill. Again, that's an important one to remember. And your employer should allow you to carry over into the next leave year up to 20 days annual leave if you could not take all your annual leave before the end of the leave year because you were on maternity leave, adoption leave, or shared parental leave. So I think we're going to move forward again. And this is the final topic we're going to be talking about before the next section. And this is sick leave. So statutory sick leave, essentially time away from your employment because you are ill. To qualify for sick leave, you must provide your employer with proof that you're ill. During the first 7 days, you probably will have heard of this. It's called a self-certificate. So you self-certify that you are too ill to work. After 7 days, your employer needs a fit note certifying that you are not fit for work. And you can get these fit notes from a GP or a hospital doctor, a registered nurse, an occupational therapist, a pharmacist, or a physiotherapist. So if we move to the next slide. And this is where we finished and going through. My colleague has put this reference in for anybody that might be interested. And I think that's the end of my slides and some useful sources of information. I've mentioned it a couple of times, but I would absolutely, I'm sure some of the topics that we've raised have raised questions with yourself about something that's happened in the past, the present, or may happen in the future. I would really encourage you, if there's an individual situation or position, to seek appropriate individual advice. If you are a member of the Royal College of Nursing, we would ask you to do that through RCN Direct. And here are some of the details. There are, for those that are not RCN members and people who are who'd like to look it up, I would also just give you those information numbers of ACAS and the Citizens Advice Bureau. So I think that's my last slide, Lindsay. And so at that point, I will be handing back to you.
Lovely. Thank you so much, Jenny. That was really comprehensive, and hopefully that's been incredibly useful for all our participants on this webinar. Okay, so we'll be moving shortly into the question and answer session. Jenny and myself will endeavour to answer any questions that you've got. So if you want to start popping those into the Q&A, there's a button just at the top that you can press and start putting those questions in. I'm just going to quickly run through 5 reasons why you should join the Royal College of Nursing. I am hoping, fingers crossed, that all on the call are in fact in the college. But just in case, I will just quickly just go through. So first of all, the main reason why the majority of our members join us is for professional development. We are a trade union, but we're unique in that we're also a professional body. And with that means that we support lifelong development. There's access to RCN Learn, huge amount of resources on there. And we also, at Cavendish Square and in our countries, we also have Europe's largest nursing library. So if you're considering doing some further education, degree, masters or whatever, you will hopefully find what you need within our library, and our librarians are also superb at sourcing and giving advice, and you can do some of that online as well. Our forums and networks are there if you want to become active within those. And as well as that, we have Congress once a year. Next year it's in May. It's in Liverpool. It's a very vibrant event, 3-4 days networking and wonderful debates. So certainly that's something for all those on the call that you might want to consider. As well as that, the regions and the countries through branches run local learning events. So if you go onto the website, you will find that if you go onto the regional pages, you'll get access and find out when those are on. So you can join those, and that hopefully will help with your development as well as revalidation, etc. The other reason that our members join us is for workplace support. We obviously are what we says on the tin, the Royal College of Nursing. So we're the nursing specific trade union in the UK, and you will get specialist workplace support and guidance. So on there you can see if you've joined the college, rcn.org.uk, get help. You can go online, and we have ability to get questions and answers online, or you can also phone RCN Direct if you actually want to speak to somebody, and then you'll get referred to the regions and countries if you need that specialist support from our network of regional officers, and also our representatives, our activists who work within the workplace. Legal advice. So obviously, if things become a bit more serious, if for instance you get referred to the NMC, then we can help and support there. Comprehensive support and information from that's the largest in-house legal team of any UK trade union. And if you are referred to the NMC, then you will get support from a solicitor. And we have, very, very good results. We've got a very good relationship with the NMC. Member support, emotional and practical support with immigration advice. We've got an immigration department who are very knowledgeable and there to give you assistance and support and advice around visas, etc. There's welfare guidance, support, financial wellbeing. We have a welfare team. Career coaching, so when you're looking for the next job, etc. Telephone counselling, peer support for our members with disabilities, and then also a handy guide to common English expressions. So that's also there, as well as I've already referenced, careers advice as well. As many of you are in the independent sector, we've heavily invested in supporting our members in the independent sector, and we now have a team of independent sector lead nurses that are working across the regions and countries. So they are also there to help and support you. So that's the pitch around why you should join us. We're now we're well over 500,000 members. So yeah. Okay, so let's see if we've got anything in the chat. There's nothing actually in the Q&A. Has anybody got any questions at all? If you want to come onto the webinar, pop your hand up, and we'll look to see if we can bring you in to ask your question, if that's easier. Otherwise, Jenny, I think you've done an absolutely amazing job, and you've clearly made it so clear. There's no questions. Bernice has asked, is there any difference between the present statutory leave and after Brexit? Jenny, do you know the answer to that one?
Well, one thing I would say, actually, as I explained, my colleague Barry has presented this last year and has prepared it for this year. And one thing I would say is that this information is constantly changing. Brexit or no Brexit, the environment, the legislation around statutory leave is constantly evolving. So this gives me a great opportunity, Lindsay, because one thing I didn't mention in my presentation is we're always a bit reluctant to send out the slides as they are. The one reason is because it changes very rapidly and very quickly. So in terms of your individual position, we would always advise you to check it at the time. And I was talking to my colleague before, and one of the reasons we're running this webinar again, just one of the reasons we're running it again because we might reach new people, is that actually there's been some changes since the last time we ran it. So I don't really have any comment about before or after Brexit particularly, but I do have a comment to say that what I would thank you for the opportunity in asking that question, because this situation is changed. It has changed in small things and subtle things. What we do know is that there is new legislation coming in around employment, and Lindsay might want to say more about this than myself as well, but there could be changes in the future and because of new changes. So what we're talking to you about today is a moment in time, and thank you for the opportunity to let me say that. And we would just say this has given you some of the information right now, but it would be further advice to always check that position. I'm not sure if the recording will be available, but we wouldn't be sending the slides out. That's quite normal because it changes so rapidly. What we wouldn't want to do is give you the information, the snapshot in time now, and very quickly that changes. But hopefully what we have given you is empowered you and enabled you to understand the concepts and where we are now and some of the planning and understanding and how you and that will help you talk to your employer, but always check those details at any moment in time, both the statutory position, and I know we keep reiterating it, but that's why we have the advice line, not like RCN Direct, but always, we'd be encouraging everybody to actively be aware of what is in your contract of employment and looking at that as well. So I hope it doesn't directly answer the question, but thank you for the question, because I think it gives me the opportunity to say, yes, things are always changing. I don't actually know all the time the different factors, and there are many different factors that mean these things are changing, but hopefully that highlights that point.
I think it answered the question. I think nothing has changed. I would say I certainly didn't note that anything had changed in terms of that after Brexit. So hope that answers your question, Bernice, and thank you for that. And so the next question we got is from Eric, and he said, get your words out, Lindsay. After self-certifying sick, you're given 7 days doctor's note of not being fit to work. How many days can you request again if you're still not feeling well? I think the answer would be that you can request what you need if you're sick and your doctor feels that you're not fit to work, then he will extend the fit note. I'm not sure, Eric, whether your question was maybe in relation to how much statutory sick leave you might get. Jenny, was that one? Is there anything you wanted to add to that?
Yeah, just what I was going to say was I agree with you completely, Lindsay. I would say from a practical point of view, some of this giving of information, I hope what we've done is highlight the process. So I think one thing that's really helpful when you're on, and it's difficult when you're unwell or it's difficult when you're having a crisis, but I would say on a very human level, always try to think ahead and plan, because some of these things in terms of informing your employer or indeed talking to somebody that can give you the fit note requires some planning and some thought. So I think that's again thank you for the question, because I think what it's highlighted to me is just to say to people, Lindsay's absolutely right. You need to go to a medical professional to get a fit note. But one of the things we're trying to talk through and help people understand is what the expectation is of your employer. So you might have to think that ahead. So if it's run out and you need to get that fit note from a medical professional, it's helpful that you've had some sort of planning. When can I contact them? How soon can I get that to my employer? And communication is always vital in that. And I think that's one of the things with all of these types of leave, is understanding your rights is absolutely fundamental, but really trying to think about how clearly you can communicate that and what leave you need within the requirements, that the statutory requirements that your employer needs you to do. So that for me has given me an opportunity to say, yeah, have a think about how you get those fit notes. And reiterate what Lindsay said, that you should be asking your medical professional that you've approached for what you need, and to get that to your employer as soon as you can.
Richard's put a question in is, can one request for annual leave from two different employers? Thus, if I work for two different organisations, I'd say yes, absolutely. Presumably you work on different days of the week, so you just submit annual leave to the different organisations. If you work for two different organisations, Jenny, I've got that one correct, haven't I? Okay.
I think so, yeah.
We've covered Eric's, we've covered Benice's. How do I register for the next session? I think that's in the chat, how to register for that one. But if not, Jitten, if you can get that in there. Another one, hello, thank you for this presentation. Please can we get a copy of this presentation or recording? It's been recorded, so that should be available. Can I take my maternity leave while on COS? I don't know what COS, especially if I have only a year on my contract. And do I stand a risk of losing my COS or contract? Do you know what COS is, Jenny? I'm blank.
I don't, and to be honest with you, I think maybe that's one for RCN Direct to do an individual answer to that question. I don't think we've got time, Lindsay, to unpack it, if that's okay.
No, that's fine. Can individuals get bereavement leave for late parents, please? I'm not quite sure what that means. I don't know if that's retrospective. You haven't taken bereavement leave and you want it. I'm not sure. Jenny, are you with me on that one?
I think again, we could ask quite a lot of questions, Lindsay, but maybe that's one we're going to have to defer either to next week or RCN Direct, because we're coming right to the end. It's actually 7 o'clock now, so apologies, everybody. I'm not sure we've got a quick answer to that.
And then the very last one is, how many times can you take sick leave in a year? I think again it depends on the policy.
Yeah.
Some organisations they have a limit, unfortunately. That's so okay. Just moving back to the chat to see if there's anything else in there. No, so we can see in there that the booking, you can book. There's the bit in there about booking for next week. There's a quick question there. Do you provide any training and contact via telephone to RCN member? Last week I received a call, told me she's from the RCN and she asked to book a training, whether I'm interested or not. That would be probably RCNI. That's one of our a sister company of the RCN. So yes, and you will get calls if you belong to the RCN from RCNI, and do ask that question directly from RCNI. And that one's been answered as well. Okay, well, we're 1 minute past 7. Just want to thank you all for joining us tonight. I hope you found it helpful. Just a reminder that the evaluation is in the chat, so please do fill that in, because it helps to inform us for future webinars. But otherwise, thank you ever so much for joining us, and hopefully we'll see you next week on the part 2 webinar. Thank you, everybody. Bye bye now.